Alright guys, welcome to Acharya's Learning. Today we'll be discussing and talking about the thyroid gland here. So let's start. So if you come back here, okay, we're gonna actually first talk about where is thyroid gland located, okay? But before we go there, okay, one more thing I have to say is that, thyroid gland is one of the most important gland in our body, okay? It's also one of the largest endocrine gland, okay? And because it is important for synthesizing so-called your thyroid hormones. And remember guys, thyroid hormones works almost in all cells, okay? And it is important that, that we have a good amount of thyroid hormones producing, okay? Because those hormones are required for your cell maturations, okay? The cells to function really well, to maintain your basal metabolic rate, okay? There are other functions also that we'll talk about in physiology, okay? But right now, first, as I said, we'll talk about where is this thyroid gland located. And as I said, thyroid gland, as we all know, it's located at neck area. But we have to know a little more than that, right? So if you come back here, okay, I drew the structures right here, all right? So let's label this first, okay? So if you come back here, look at this shape of the structures, okay? This is so-called as this structure right here. We call these structures as so-called as your thyroid, okay? Thyroid cartilage, okay? That's what thyroid cartilage is, that, okay? And below that, this in a blue, this is also endocartilage, okay? And this is called your so-called your cricoid cartilage. What is it called? Is your cricoid cartilage, okay? And what is connecting these two is a ligament, okay? It's a cricothyroid ligament is connecting this thyroid cartilage and cricocartilage, right? And if you come back here in this orange, you see that is your trachea, okay? Below the cricocartilage, okay? This is your trachea. And remember from your respiratory system, trachea has what? They have those C-safe ring, the cartilage ring, okay? That I've also labeled that, okay? And this orange is obviously, this is all trachea, okay? Now, there's also what is connecting this cricoid cartilage with this trachea is also ligament, okay? Cricotracheal ligament, okay? That's what they call, right? That's connecting this two. And this thyroid gland is, the locations of thyroid gland is inferior or below the so-called your thyroid cartilage right here, right? Thyroid cartilage, and it's like above the trachea, okay? And this thyroid gland is about at the level of so-called C5, okay? And then ends it at about a T1 or so, which is a thoracic, okay? Because if you see this, okay? That's what the locations of your thyroid gland. That's what I wanted to quickly emphasize on. Now, this thyroid gland is highly vascular, okay? Highly vascular, meaning that, okay, it receives about, okay, 80 to 100 ml of blood per minute. Thyroid gland is highly vascular, okay? And we'll talk about what are those vascular supplies of this thyroid gland too, okay? So that's what we're going to discuss now. So obviously this is a butterfly-shaped structure, which is a thyroid gland, right? Now, and also one more thing is that, guys, you should also know that what is the weight of the thyroid gland, okay? Normally, okay, it's about 20-25 grams, okay? That is a weight, that's the mass of your thyroid gland, okay? It can be varies from person to person, but that's an average, okay? Now, if you come back here, okay, we have to look at this structure, we have to talk about this, the vascular supply to thyroid gland, okay? And its clinical importance of it. So if you see here, okay, what is this? This is my arch of aorta, right? An arch of aorta, and we can say this is the right side and we can say this is the left side, okay? Remember, arch of aorta gives branches, okay? This, if you come back to the right side, it gives a brachiocephalic trunk, right? They also call this an innominate artery, right? So this is my brachiocephalic artery, which gets splits into so-called as subclavian artery and common carotid artery. But because this is the right side, we call this a right subclavian artery, and this one we say the right, okay, common carotid artery, okay? That's what we call. And the right common carotid artery, it breaks down into so-called as a external carotid artery, okay? External carotid artery. And then this one is going to be your internal carotid artery. Internal carotid artery. That's what it does, right? Now, Obviously, this is the right side, so we call them a right external carotid artery and the right internal carotid arteries. That's what it's going to be, right? Now, that's what it is. Now, same thing if you come to left side, okay? Left side, there is a artery that give direct branch, which is, this is going to be this one right here. It's called left subclavian, okay? It's a left subclavian artery, okay? And then it gives a left common carotid artery. This is my left, this one is my left common carotid artery. And the left common carotid artery again splits into so-called your, let's say, external here, and then we can say internal there, okay? And this is obviously going to be your left side, right? Now, once we know this, okay, we have to label this, okay? And the labeling part is that what happens is that this external carotid artery from here, that give a branches to supply this your superior and then anterior part of your thyroid gland, okay? That is coming from this branch right here, okay? I'm going to draw this one. This branch supplies right here, okay? And this is supplying the superior and anterior, okay? Because it supplies the superior portions of the gland, thyroid gland, we call them okay, I'm going to write it down here, okay? This is very, very important, branches. We call them as a, okay, this one right here, we call them as a superior, okay, thyroid artery, okay? That's what it is. Now, same thing's happening from the other side too, okay? So superior thyroid artery is a branch of external carotid artery. It is supplying the thyroid gland, okay? Now, there's also one more artery that is coming from, okay, that is supplying here, and that is called inferior thyroid artery, okay? That's called inferior thyroid. And where is the inferior thyroid artery coming from? That's what we talk about, right? Inferior thyroid artery is, okay, it is not coming from external carotid artery, okay? It is not coming from internal carotid artery, okay? It is coming from so-called as, if you see here, okay, this left subclavian artery right here, right? This subclavian artery give one branch, okay? It is called thyrocervical trunk, okay? What is it called? It is called so-called as a thyroid, okay? And they call this as a cervical trunk, okay? And I label this as this one. And this thyrocervical trunk, okay, gives branches, okay? That branch comes from here and supplies this so-called as your inferior aspect of this, okay? This inferior and then posterior aspect of the so-called as your, you also supply go there, okay? Inferior, and then we can also draw the superior part of this external carotid artery too, okay? Like this. And this inferior, this is called, they call this, because it's supplying inferior, we call them as a inferior, okay, let's write down, inferior thyroid, okay, artery. That's what it does. Isn't this cool? Okay, those are the branches that is supplying to so-called your thyroid gland, okay? Now, one thing that you have to understand here is that, okay, the clinical importance of this too, okay? And let's go and talk about this, okay? Okay, so, you know, one thing that is happening here, okay, actually, you know, yeah, let's talk about the clinical importance. Because, let's say somehow, if you need to, like, you know, resect your thyroid gland, okay? So, if you see here, okay, there's a superior thyroid artery, okay? One of the things that you have to understand here is that you see this nerve right here, okay, this one, this nerve coming down here, this is my vagus nerve, okay? This is my vagus nerve, okay? That's what my vagus nerve is, this one. Even right here, okay, right here. This is the vagus nerve, okay? What do you call this? Vagus nerve, okay? What happens is that a vagus nerve gives the branches because it's supplying to, because there are, okay, remember there are muscles on top of this, there are also different types of muscle, like omnipresence, hyoid muscles and all that stuff, okay? There's one branch that's coming from the vagus nerve and it's going on top here, okay, like this, okay? It is kind of like coming down here. And this nerve is so-called as your, okay, external, okay, laryngeal, okay, laryngeal nerve, okay? That is what it's here. So whenever, like, you know, whenever you try to ligate your superior thyroid artery, okay, you need to be very, very clear that, okay, you do not damage, okay, the external laryngeal nerve, okay? So whenever, okay, you're trying to ligate, I'm going to repeat one more time, it's very, very important. Whenever you're trying to, okay, ligate the superior thyroid artery, you need to make sure, you need to watch out for the external laryngeal nerve, okay? Because that is also coming or right near to the superior thyroid artery, okay? That is one of the clinical importance, okay? Because if you can damage the external laryngeal nerve, whatever nerve external nerve's functions are, or whatever muscle it supplies, that will be compromised, okay? That's the reason why you have to be very, very cautious whenever you, okay, whenever you're working on the superior thyroid artery. But there's one more thing also here, okay, but remember, there's also one more nerve right here that is also coming from vagus. Look, it loops around and goes back like this, okay, and turns around and turns and come back, okay. This is looping, it's still the vagus nerve, okay. Whenever this gives this nerve which is looping around and coming down, this is so-called, this nerve right here, this one, also it's coming down this side also, okay. This is called my, okay, it is called my recurrent, okay. This is my recurrent, your recurrent laryngeal nerve, okay. This is my recurrent laryngeal nerve, and both the side has it, okay. So here, what we have to understand is that right now it is going to more inferior areas, okay. So this is, we have to understand here that when you're getting inferior thyroid artery, we need to watch out for this dog, okay. This dog is what? Your recurrent laryngeal nerve, okay. Because it is important, right? It's supplying the voice box, right? Because you can have a hoarseness, okay, whenever there's a damage on your recurrent laryngeal nerve, okay. So that's the reason why whenever you're not right now if you're working on this so-called as your inferior thyroid artery or ligating, then you should also look for the recurrent laryngeal nerve. That's what you should focus on, okay? That's something that I wanted to quickly touch on that, okay?